How many Americans will face climate gentrification? The Mary Lou Retton story is even worse than you think. And are Republicans bringing syphilis to red states? Let me tell you all about those things. We'll start out with a climate gentrification. Now, most of us know what gentrification is. I remember when I was living in Washington, D.C., Louise and I lived in a neighborhood. We lived on a boat in the marina there that was surrounded by a waterfront neighborhood that was largely low income and black. There was a large housing project just down the street. And during the 7 or 8 years, I guess it was 7 years we lived in D.C., during those 7 years, that neighborhood just went through a complete transition. They tore down old houses, they tore down buildings, they built new hotels, they built, the whole waterfront thing got rebuilt. Apartments that had been selling for $30,000, $40,000 were selling for $300,000 and $400,000, in buildings that were going to be torn down. I mean, it was just people were. That's how gentrification works. So you're familiar with that. But I'd never heard of climate gentrification until I read this article about what's going on in Miami. And that is that as the water levels are going up, Miami is starting to get wetter and wetter, and heavy storms and high with these called king tides, these tides, high tides that are higher than normal, high tide with a full moon and all that kind of stuff. And it's starting to leak water into the streets of Miami. Now, there is a neighborhood in Miami called Little Haiti, and Little Haiti is very poor and very black. But Little Haiti is also 10 feet above sea level, whereas the rest of Miami is 2, 3, 4 feet above sea level. And so what's going on right now is that suddenly there are developers buying up properties in Little Haiti and pricing out the locals who have been living there in some cases for generations, in some cases probably for centuries, or at least a century. And it's literally gentrification. There's an article about it that was published Monday of this week in the journal Environmental Research Letters. They found that at the current rate of sea level rise, by the end of this century, there are 2.6 million people in the Miami region are going to be basically underwater. And that these homes, these very wealthy homes in the beachfront areas that are at sea level or a foot above sea level, they're starting to lose their value very, very rapidly. Many of them can no longer even be insured, whereas the homes in Little Haiti and some other communities, some of the other poorer communities in Miami that happen to be 10 feet above sea level or more, they're now increasing in value and thus pricing out the local folks. Fascinating stuff, just an FYI. It's kind of our geeky science for the day. Remember Mary Lou Retton? I guess you've got to be a certain age. I mean, she was a big deal in the 1980s. She was on the Wheaties box, remember? With her, winning the Olympics on behalf of the United States. She's broke. And the thing that broke her were medical bills. Now, this is something that does not happen in any other developed country in the world. It doesn't happen in Canada, doesn't happen in Costa Rica, doesn't happen in France, doesn't happen in Germany, doesn't happen in Norway, doesn't happen in Denmark, doesn't happen in Greece, doesn't happen in Italy, doesn't happen in any other developed country, Australia, Taiwan, none of them. South Korea, people do not go into bankruptcy or post, please heal me, please help me on GoFundMe sites because they have medical bills. Because in every other developed country in the world, medicine is considered part of the commons. It's administered by the government, it's paid for by the government, and it's cheap, and in many cases, it's free, and it's widely accessible. But not here in the United States. Here in the United States, we have turned healthcare over to these predatory corporations, basically. And Wendell Potter is writing about this over at wendellpotter.substack.com, his newsletter, about Mary Lou Retton. He says she's so deeply in debt that her family launched a crowdfunding campaign, a GoFundMe page. He said, meanwhile, I'm quoting from Wendell Potter, the former vice president at, I believe it was it Aetna? Cigna, thank you. Former vice president over at Cigna, one of the senior executives in one of the big 5 health insurance companies, Wendell Potter, been a guest on this program many times, author of a couple of brilliant books. He writes, meanwhile, on Friday morning, United Health Group, the nation's biggest insurer, said it made $8.5 billion in profits between the 1st of July and the end of September on revenues that totaled $56.7 billion. All that in just 3 months. He said about half of Americans have difficulty paying their medical bills, and 250,000 of us resort to publicly begging for help on GoFundMe because of medical bills. Again, no other country in the world has this problem. No other country in the world has predatory corporations running its health care. He goes on to note, United Health, which reported $25 billion in profits during the first 9 months of this year, said on Friday last week that it expects to make even more money than it previously thought possible. And so it spent $11.5 billion during the last 9 months rewarding its shareholders, 89% of which are large institutional investors, and 17 investors own half the company's stock. And it just handed out $11.5 billion to them. He said one way United Health and other insurers make so much money is by forcing people enrolled in their health plans to pay hundreds and in many cases thousands of dollars out of their own pockets before their coverage kicks in. Increasingly, people begging for money on GoFundMe and other crowdfunding platforms have health insurance. They just can't afford the copays and deductibles. He says United Healthcare is also making massive profits from the so-called Medicare Advantage program. Although United Health, I'm quoting Wendell Potter here, former health insurance industry executive, although United Health has 3.5 times more people enrolled in its commercial plans than its Medicare Advantage plans, which it co-brands with AARP, it now makes more money per person on the public programs, Medicaid and Medicare. Our government has largely turned over to private insurers. United Health gets 35% of its total health plan revenues from its Medicare Advantage business. Another 20% comes from running Medicaid programs for states. He said Retton is only 55, so she doesn't qualify for Medicare yet, so she's stuck. She's among the 27.5 million Americans who don't have health insurance. 27.5 million Americans don't have health insurance.